Bismillahirrahmanirrahim. My name is Asin Salim and my roll number is BP1650016, and I'm here to present my assignment of course PHP 705 Pharmacy Practice 3 on the topic of rational and irrational uses of drugs along with the case study. And my drug is aluminum hydroxide. So let's begin with its basic introduction. Aluminum hydroxide is an antacid, as the name indicates itself that antacid, ant means anti and acid, so means working as an anti-acid, means working against the acidic concentration. So basically it's basic or alkaline in nature, and it's used to neutralize the acidity in the stomach, which may be increased due to the increased H plus ion concentration in the stomach, or HCl excessive secretion that leads to the sensation of heartburning and indigestion. So this antacid basically increases the concentration of phosphatase ion that reacts with the H plus concentration and brings the pH back to the normal stomach pH. So it is indicated in certain conditions like calcinosis universalis, chronic diarrhea, hyperparathyroidism, hyperphosphatemia, renal failure, nephrolithiasis, peptic ulcer, reflux esophagitis, stress ulcer prevention. So it is available in many types of dosage forms, that is syrups, suspensions, tablets, gels, and capsules. But most commonly, they use are suspensions and syrups because they are easy to use, and the patient compliance is more in syrups and suspensions. For this, common example for this is eno, and usually aluminum hydroxide, whenever prepared, as prepared in a combination with other ingredients or other oxides such as magnesium hydroxide and etc. So the dosage for the aluminum hydroxide is 600 to 600 milligram for adults. Uh, that is as per recommendation of the physician, and that can be up to 7 times per day, and it could be varied depending on your meal concentration or the severity of acidity. The other doses includes 250 to 1500 milligram, uh, which is given 8 hourly, and 500 to 1800 milligram, that is given 6 hourly. That depends on the six single dose concentration. We don't have exact data for the pediatric dosage, but for the neonatal dosage, we go depending on the weight, which is 64 to 120 milligram per kg of the weight, and it is given orally by each 6 hours. There are certain conditions in which we should not give aluminum hydroxide, especially in pregnant women or the patient who have kidney problems, because in or they are suffering from renal failure, because in certain conditions, we as we know that it increases the phosphatase concentration. So the phosphatase concentration may lead to kidney stones, or they need to be removed from body via kidney. So in case of kidney impaired function, this becomes difficult, and that can lead to kidney stones and other complications related to it. So in that certain conditions, we should not be giving aluminum hydroxide. Other conditions include osteomalacia and intestinal obstruction. Uh, there are certain side effects of each drug, and similarly, we have for aluminum hydroxide too, which is dementia, proximal myopathy, and encephalopathy. Aluminum hydroxide is not usually used irrationally like other drugs, but there are certain conditions like on even minor feelings of acidity, even if you are not sure, or vigorous use of aluminum hydroxide is taken by certain patients, which can be which can decrease the efficiency for the drug for that particular person's body for further conditions. So one of the irrational use for aluminum hydroxide is this, and certain physicians used to prescribe it to just increase the regimen so which is not a good optimum use of this drug. There are many brands available. Almost all the industries available in Pakistan have a certain dosage form, any kind of dosage form for this drug, as it is very common problem nowadays with the disturbed sleep level, disturbed diets, fast foods intake, and spicy diets and other complications like stress. So acidity is a very commonly occurring problem nowadays for people. So this is a very common drug used, and few of them are given here in suspension form, which is 215 milligram per 5 ml. These drugs are these drugs are usually commonly available and cheap, and so easily accessible it by every pharmacy. So these are given below: Elucid MP, Elmacin, and Elmajex. Different industries have made this. Now let's look out a case study regarding this. AK is a 50-year-old person with a medical history for acidity and heartburn from last 6 months, and he's a local person, so usually using without prescription home remedies to decrease this acidity and heartburn. So he came to clinic this morning with an increase in the severity of his acidity and heartburn sensation, and we have taken his basic readings for certain aspects, that is includes its weight, that is 250 pounds, with a rise in blood pressure which is 150 by 90, and an increased pulse which is 88 beats per minute, and has a complaint of a medium pain which is around 4 to 5 degree on a numerical scale of 0 per 10, with a respiratory rate of 24 per minute. Now let's see what can be the reason of this uh, pain. So a 50-year-old person who is, by visualization we can see he is obese, and he's complaining about pain, heartburn, and acidity. He's on no medication for now, and he has so with some basic readings we have taken a few other observations and tests that includes HbA1c, which describes the sugar level whose levels are 4.2 to 6.0, and its reading says 5.0, which is around normal. It is kind of a pre-diabetic condition. Similarly, we have taken cholesterol, which is 190, and his normal level is 200, so it is also on the borderline, which may be a aspect in the cause of acidity. Further, on observation, we have found it that the abdomen is distended, means it has been out of shape, or you can say de delocalized, or is not normally at its position where it used to be, and certain discoloration of skin on the area where patient is complaining about abdominal pain. So what could be the reason? The reasons could be improper diet, spicy diet intake, fast foods, not balanced diet, not optimum time of eating, lack of sleep, and lack of fluid intake or stress levels. So we have two kinds of plans for him. One is pharmacological, that is we will prescribe the antacid, that is aluminum hydroxide and magnesium hydroxide, which is given on the onset of acidity, and when you feel this kind of acidity you can take it. And the furthermore, we have second plan is non-pharmacological, which is we will prescribe him regular exercise to decrease its weight, and change in diet by referring to a nutritionist properly, with and certain suggestions such as increase in the fluid intake, increase of milk, and decreasing the spicy diets or the intake of red meat, which usually causes acidity. So this is a patient's case study from an hospital, and that's all. Thank you. Allah Hafiz.